at that point in time, I don't think anybody was really paying attention other than the families that knew that they had lost loved ones. But if you think about that we are exactly 1 month from when we had our first patient for the coronavirus. So it was the 19th or the 20th of March. So try to think back where we were 1 month after the BP blowout. There's still a lot of confusion. Oil was spewing into the Gulf. We didn't know how to cap it. Beaches were closing down. People were canceling vacations. Tremendous uncertainty. Really not indifferent than where we've been probably the last 6 weeks. So what we do know, though, is that we learned some lessons from the BP blowout. And we'll learn lessons from the coronavirus. And actually, as I think about it, and for those that saw the video that we did on the public school system, I would have to think that our public school system has come up with new ways to teach our children that will be long lasting. I think that all businesses have learned something about teleworking, that will be long lasting. Now, I do fully realize that some of these things are not things that that are normal to us, and really some of them many don't like to embrace. But the bottom line of my comment is that we're going to get through this. We're going to get through it in a positive way. And as long as we continue to do the things we know that will help control the virus, maybe the quicker we'll work out of this. So I'd like to talk about a little bit about the testing and where we are, the current situation. And that's, as I look at the testing data, some that came out from the Mobile County Department of Health today, is that it does look like that we have the cases are maybe on the decline. Too early to declare victory, but certainly a good indicator that maybe we're headed in the right direction, and certainly that we're not seeing a spike right now like we thought we'd see a peak on April 18th. There was no peak on April 18th, and the way the trend is going, I'm not so sure that we're going to see one on the 20th or the 22nd. So we're watching very closely this week to see, what the test data is showing us. Another thing that we know is that our hospitals, have plenty of capacity. I think I'm correct in saying that we have not even approached being at 50% capacity in our hospitals. And that would include the hospital beds and the number of ventilators. So that should be very gratifying to everybody. Another thing is that we know that we've had a lot of people, if you think back on our first responders and how we tested them with antibody tests, that there are a lot of people that have been exposed that have positive antibodies for this, but they've not shown any symptoms. So not everybody goes to the hospital. Certainly not everybody gets on a ventilator. So all that is good news, and it's part of the things that we're learning that hopefully this never happens again, but if it is, we'll be better prepared going forward. One of the biggest concerns at this moment is where we stand with our nursing homes. The tragic news of the number of patients that have died in the nursing homes, while it shouldn't have been maybe unexpected because that's what everybody was saying, that they're the most vulnerable population we have, it's still so tragic and startling when you hear the number of deaths that we have, that it does make you pause and stop and think, what can we do differently than what was done in order to keep this from happening. I know that the health department is working with the nursing homes. We've been in contact with them. I know today that many of them had the employees being tested at Ladd Stadium to try to assure that they are safe to go to work. We have provided the nursing homes with some PPE. So hopefully that maybe things have bottomed out as far as the number of deaths that we've had there, and maybe even the number of sick patients that we have. Because if I were to go back and look at some of the data, you could make a case that maybe we hit a peak around the 10th of April. Certainly, if you look at going back from today, going back, there was a peak around the 8th and 9th, 10th of April. That does not mean that we won't have another peak that we've been talking about, but we'll know by the end of this week what it looks like. Another concern that we're hearing is that there are a lot of people that are frustrated with the unemployment claims and not being able to get through the 800 number the Department of Labor. The city of Mobile, our unemployment has gone from 4.1% in February to 4.7% in March. Now, but we do know this, there was a 3-week period, and I'm not sure exactly, but I'm going to say early April, that we had as many unemployment claims filed in that 3-week period as we did all of 2019. So simply put, our Department of Labor is overwhelmed. They're doing the best they can. So just continue, to call in, and so that they will continue to work with you to try to make sure that you get the money that's due you, and it should be hopefully available very soon. Looking ahead, we're anticipating that with the Lieutenant Governor having made recommendations to the governor last Friday, we know the governor is trying to decide what should be done about opening up, and we'll just have to wait and see, what she says. Internally in the city of Mobile, we're looking at several things that we have to do in order to open up. If you start with what the president's gateways were that a community should pass through, or state should pass through certain gateways, I'm sure the governor will probably tee it up in a certain manner similar to that. So now I'll give you an example. If you think about opening up right now, retail may be the easiest thing to open up. We've got a lot of stores and shops that, they never would have a problem with social distancing if they were to open up. At the same time, we've got a lot of people that own restaurants that are real concerned about opening up too soon. And we have a lot of patrons of those residents that really don't want to go, until they are convinced that they'll be safe. And so opening up is going to mean different things in different segments of our economy. But we're focusing on it, trying to help those that will make the decisions to make sure that they're based on good science and data and the best information that we have at our disposal right now. So yes, there's a lot of anxiety out there about opening up, but I can assure you, we hear the hue and the cry about let's get opened up, but please, we are not there yet. Please, we ask that you continue to abide by the hygiene things of don't touch your face, wash your hands, wear your face mask, stay at home. And there's just a lot of good advice out there, and we're hoping that you're going to follow that. And I believe that George Talbot has some questions that he has that have come in from the public. So I'll just turn to George and let George ask a few of them.
Sure. The first couple from Tyler Fingert at Fox 10. When are you looking to reopen Mobile, economy in Mobile?
So the question is, when do we plan to reopen the economy in Mobile? To remind everybody that the governor has got to, and the state health department have got to lift the ban that they have, and then the Mobile County Health Department would have to lift the ban on restaurants that it imposed. But once those are lifted, then I think that we'll start that process of deciding what is the methodology we'll have of opening. I'm ready, or we'll be prepared whenever the existing orders expire. And probably just prior to the expiration of those existing orders, we'll be able to tell you when we'll be opening.
We are at or near the peak, according to the health experts. How do you think Mobile is doing at this time?
I think that Mobile, based on information that we have presently, we may have already hit our peak. Matter of fact, I can say assuredly, based on the data that we have, there was a peak, around the 10th of April. Whether that is the peak that we're all projecting, I don't know the answer to that. But I think that we're doing relatively well, and I think the trend is headed in the right direction. And that is, we're having fewer calls for people making appointments to go to LAD and to the other testing sites. And so if you are not making appointments, that means you have fewer sick people. So I think we're headed in the right direction.
What about PPE, personal protective equipment? Is the city getting any? Is there a shortfall there?
I believe the question is about, is there a shortfall of PPE and is the city getting any? Yes, we continue to have, various individuals or entities call us and say they have found some PPE, and do we have a way to distribute that? And the answer is always yes. I think the PPE is going to be a challenge, at least for the next 30 to 60 days. I don't see that going away anytime in the near term.
What are you hearing from businesses? How are you? What feedback are you getting from businesses about getting back to work?
So if you just take the two that I mentioned, retail and restaurants, retail I think is ready to go. I mean, they're all aware that they have the ability to social distance within their stores, and that they would be very comfortable opening up. It's not so simple for the restaurants, and so we're having mixed conversations with the restaurants. Some are saying they need a little bit more time. They're concerned about how to make sure that their customers feel safe, but they're working through the things they think they can do to overcome any fear or anxiety. So I would see possibly that retail could open up probably before the restaurants. You may give the restaurants the green light to open up, and some of them may not do that.
This is from Jason Johnson at Lanyap. Have you thought about making test kits available to businesses, to restaurants, to help them?
Yeah, so the question is that we thought about making test kits available, and the answer is absolutely. I mean, we had a conversation this morning having to do with, the number of test kits we have available and how do you select which businesses to test. We haven't got a definitive answer on that, but they're probably without exception, every business would like to have their employees tested so that they have a sense of comfort opening back up. The challenge with the testing and the test kits, if it's the antibody test kit, or really any test, it's for a moment in time. So theoretically, if you tested all 200,000 Mobilians right now in the city, a month from now, many of those that tested negative could be positive. So we've got limited resources. We have some of our workforce that has more exposure to other people. And so trying to put a priority on which you would test is not an easy thing to do. But we do know it would be helpful, and to the degree that we have resources, we probably will select some that we could test on a trial basis and see what happens with that.
It's from Dana, WKRG. How are the hospitals doing in terms of their capacity?
I think I touched on that. As far as the capacity at the hospitals, and if you think of the critical part, and that would be that they run out of beds or they run out of ventilators. None of the hospitals have even approached running out of beds or using all the ventilators. So I believe that we're in excellent shape at the hospitals.
Mount Vernon is now enforcing people to wear masks while inside stores, and if they don't, they could be fined. Is this something being looked at in Mobile?
Well, yes, we looked at whether to make it mandatory and whether to fine people that were shopping, and the decision was made by the Unified Command that we were going to strongly recommend that masks be worn while shopping, but it was not going to be mandatory and there wouldn't be a fine attached to it. The thought being that maybe peer pressure, and the peer pressure would have a lot to do with enforcing that.
This one is about the long-term impact on retail. Are you worried about the future for retailers, for the mall, for the big shopping centers in Mobile, long-term? So
we're worried about retail long-term, the malls, just the bricks and mortar. And the answer is, I don't want to use the word worried. I would prefer to use the word concerned. And I think that that's where we are. I mean, it was a changing world out there because of the online sales prior to the coronavirus situation where we are now. So I think it's going to be very difficult to predict what's going to happen in the retail world going forward. But like a lot of things, they're going to be, those that figure out a way to survive, they'll do it.
This last one, this will be a George question. So lots of people are binge watching a lot of TV, watching new series on Netflix, online. Have you had any times to tune in and watch anything over the weekend? I know you're working a lot. Is there anything you've seen?
Yeah, Designated Survivor. It's addictive is all I can tell you, and it's about the Designated Survivor. If something were to happen to the president, the vice president, and all of Congress, as in blowing up the Capitol building during the State of the Union, and it's captivating is all I can tell you. If you don't have anything to do, tune in. If you're really busy and have a lot to do, don't dare turn it on. So anyway, look, I feel good this morning, this afternoon, about where we are. So much stuff has been done. We're in great shape when it comes to, when we compare ourselves to other cities, when it comes to the testing. We have as much testing capacity right now as anybody that I'm aware of. We're open-minded about trying to help businesses test employees. We're trying to look for solutions to all these challenges that you have and that we have. And so I know that by the time we get to the end of the week, we'll have more information. And again, I'll flip back to the Deepwater Horizon. 30 days after it happened, we were still in a state of flux. There were so many unknowns, and we're still right there with this situation with the COVID-19. But every week that goes by, we're learning stuff and we're doing things to try to get back to work, to try to protect your life and your livelihood. So thank you very much.
Thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Mobile Mayor Sandy Stimpson. He is hopeful that the number of cases in Mobile County will be on decline soon. He says that we did hit a peak on April 10th. Now, that may not be the peak that we've all been talking about, but there was a peak on that specific day. The mayor also says the hospitals still have plenty of beds and ventilators available. Now, talking about the situation with our local nursing homes, he says that it's tragic. Mayor Stimpson says many of these employees are being tested for COVID-19 to ensure the health of those employees and the patients. With unemployment, he says that the Department of Labor is overwhelmed right now, but they are working really hard. He encourages you to continue to call to receive your unemployment. Now, Mayor Stimpson explained that many folks are ready to see Mobile County open up again. He says that we are not there just yet, but we are making progress. Thanks for joining us today. We will break down all these new details for you coming up on Fox 10 News at 4 p.m. I'm Chelsea Sayasan. We'll see you soon.